Well, what is your perio potential? So we're going to do some math here, okay? And you guys be kind to me, right? I'm a hygienist doing math in public, so you got to be nice, right? You got to help me out here. All right, so here's what we're going to do is we're going to calculate. We're going to calculate the potential number of quadrants of scaling root planing that you should be seeing in your practice based on what you say the level of disease that's present, okay? In fact, we're going to be super conservative. We're going to go way lower probably than what you believe is the level of disease that's in your practice, okay? So who would like to share their, just share like the number of new patients that you have, and let's work this out for you in your practice. Who'd like for us to do this for you? I'll do the math for you. Anybody volunteering? Volunteers? We're going to work this out for your practice, what your perio potential is. Okay, yes, great.
I'm trying to get 25 new patients a month.
Okay, 25 new patients a month. Okay, awesome. And what did you say, what did your team say you thought was a percentage of those patients that fall into that level of disease? 75%. Okay, so we're going to be conservative and we're going to go with 50%, okay? So we're going to say 50% of 25, and let's say just to make this, to make the math easy so that I can have some easy math, we're going to go with 24, right? So that's 12 patients. And then again, to be conservative, we're going to say out of those 12 patients, let's say that they need localized therapy, right? So they don't need 4 quads of therapy. Maybe they need 2 quads of therapy on average, okay? So times 2, that brings us back to 24. So this is a really easy thing that you can do in your practice is you can see what's the number of quads per month that we're performing compared to the number of comp exams per month. If that number is pretty close to the same, then you're probably doing a pretty good job of enrolling new patients into therapy, okay?
Can you say that one more?
Yes, yeah. If you look at the number of quads that you're performing in the practice per month, and you compare that to the number of comp exams per month, those two numbers should be pretty close to the same. If they are, then you're probably doing a pretty good job of enrolling new patients into therapy. But what else? But what's missing? What about all those other patients that you're seeing every day, right? What about the hundreds of patients that come in your practice every month? Okay, so now let's look at those. So how many equivalent full-time hygienists do you have in the practice?
Actually, we don't have any full-time.
But if you put them all together, how many would it make up, you think?
1.5.
Okay, that's good. All right, 1.5. Okay, so 1.5 full-time hygienists. Okay, and just again for math's sake, to keep this simple, one hygienist, if you put in some new patients, some scaling root planing, some open slots, one hygienist is probably seeing about 600 or 700 patients per year for recare, right? Some of them might come more than twice a year. So we're going to say, we're going to do 900. So we're going to say these 1.5 hygienists are probably taking care of about 900 patients a year. That's probably a little low, but it's close. And then do you mind sharing like what percentage of those patients you think have some level of disease?
We said about
50?
50%.
Okay, so we're going to be super conservative and we're going to say 10%. Okay, so what if 10% of those have active disease and we present treatment and they say yes and they come in and complete their treatment? Okay, so now this is 90 patients. And somebody do the math for me. What's 90 divided by 12? 7? 7? 7. Okay, so 8. So we're going to say 8 a month. Okay. Oh, wait, we missed a step. All right, so 90 patients. So that's 8 patients a month. And then again, if we're conservative and we say, well, they just need localized 2 quads of therapy, now all of a sudden we're up to 16 quads a month. So a super conservative potential for you is 16 plus 24. So what's that, 40? Yeah, so there, and therein lies the gap, right? Therein lies the gap.